Okay, so the spot here has been excised. In this case, we have a little bit of bleeding that's totally normal. Even though we cauterize, meaning try to reduce the bleeding a little bit, the best thing to do at this point is to stitch it. In most cases, when we do an intermediate repair, we're gonna do 2 layers, which means there's gonna be some sutures that are buried under the skin and will dissolve over time, usually 2 to 3 months. And then some sutures on top, as you would see, that are visible to the eye, and those are usually taken off a week to 2 weeks later. Okay, so now the first layer has been placed. As you guys see, the skin is pretty tight and close together. Right now the scar is thin and most of the wound is pretty much closed. We want to provide an extra layer of support so as the patient moves, hopefully this beautiful closure does not open. Now for this particular repair, there's different ways to suture the top of the skin. We're choosing to do what's called a running suture, which means that the suture is not cut in between spots. It's just, I should say not run, but ran over the entire wound in a single pass without, making knots in between. So now at the end of this running suture, we place another knot. Now the suture is placed. And if we look at the skin closely here, you can see that now is nice and approximated. It has good stability, no bleeding. And at this point, we'll dress it with usually a pressure bandage, and that will stay on for 12 days, okay?